So here we are with our cataract surgery patient who will have a band on their hand like usual. They'll have their name tag on and they'll have been walked in by the anesthesia tech and nurse, and the inspector will probably be where the camera is. And I'll be sitting here. I have not prepared anything yet in terms of the IV or the block. That might be a little bit controversial, but this will be my approach. The first step is dealing with the patient. Now, you have a couple of aids that you can use to help you in case you're starting to get flustered, in case you're nervous, because there's an inspector there. And what I suggest is, in the bottom of your cart, you can have our inspection protocol. And if you get flustered, you can open the drawer and take a quick look at the protocol and give yourself a hint about what's important and what you want to make sure that you get done. The other thing you could do is use the charts. At the top of the chart, it says the patient's name, their procedure, their medical history, their consent, and there are check boxes that we usually check off without looking too closely, but those check boxes kind of tell you what you have to do. So if you get flustered, look at the patient's chart, look at their history. Even if you're not flustered, look at their history, and look at our chart and make sure you're able to fill that out, and that will help guide you through the complicated part of taking care of a patient under the pressure situation with the inspector there. So the first thing we'll do is make sure we have the right patient's identity, the right surgery, the right side, and we'll get the full medical history and review the chart. Okay, so sir, what is your name? That's correct. And what is your birthday?
March 29.
And we'll check that the birthday is on the name band. Okay? So the name band's on the side of the surgery. We have their name and their birthday, and that's the proper way to check the identification. Sir, do you know why you're here today? That's correct. Do you know which eye you're having done?
My left eye.
Your left eye. So at that point you can make a little mark by the left eye, and you've confirmed their name, their date of birth, and the procedure and the side. Okay? Then you could move on to the medical history. Okay? Sir, do you take any medications? No. Okay. Good to inquire about medications and when the last time they took their medication. Sir, do you have any medical problems that you're aware of? No. Okay. So it would be your routine. Do you have any problem with your heart, lungs, kidneys, thyroid, diabetes, blood pressure, anything like that? Do you have any allergies?
No.
No. I specifically remind myself to ask about heart, lungs, and if they have anything in their mouth or if they ate anything, because that reminds me on the physical exam, you have to check their heart, their lungs, and their airway. That's part of the regulations. So, I believe we have to glove before any patient contact, and we have to Purell our hands before gloving. So, sir, I'm going to check your heart, if that's okay with you. Okay. So I have the Purell. I let it dry off. Now, I just want to point out, I left the gloves up here. They want the anesthesia card to be clean on top, nothing on top. And so I leave the gloves and the Purell up top, where I could easily get to them. Okay, so I've put Purell on my hands, dried them, and I put on gloves. Now I'm going to wipe off the stethoscope before contacting the patient. Sir, may I listen to your heart?
Okay?
Yep.
Take a deep breath in here. Good. And now another one. Good, thank you. And now can you open your mouth for me? Okay. And I could check the distance here. And could you bend your head back and forward? Okay. That should suffice for a physical exam of the airway, heart, and lungs, and that's what they're interested in. And then I'm going to once again clean off the stethoscope before putting it on the cart. And take off my gloves. You don't want to spread any germs anywhere. And after I take off my gloves, Purell my hands, which are really germ-free at this point. Okay, so we did the interview of the patient. We made sure we had the right patient, right side, right surgery, okay? We're going to check the anesthesia consent. We're going to check the surgical consent, okay? And at this point, I'm going to get ready to do the intravenous insertion and the block. Okay, so I've interviewed the patient, gone through the record, gone through the consent, we're sure of the correct side, and now I'm going to prepare my block. In order to prepare the block, I'm going to go over to the medication station, which requires me to leave my cart. Another focus is that they don't want drugs being stolen or anything, so we lock our cart when we leave it. And now we go over to the medication station where we're going to prepare. And now we're at the medication station where we're going to draw up our block. Now, why do we have to draw a block here? Because we use multi-dose vials, and multi-dose vials can only be entered away from a patient care area, and this is considered acceptable. So I have to open my medication spot. Okay, and I'm going to put my keys in my pocket. First things first, Purell your hands. Okay. I do not believe we need gloves for this. We have syringes here. In case you have any doubts, there is a sign right here that tells you what you have to do, okay? The multi-dose containers should have a date and initials. They're okay to be used for 28 days. So your multi-dose medication vial should be labeled already. I'm going to take a syringe. I can uncap and put the needle cap into the recapper. I'll withdraw my block. I will carefully recap, and I will close and lock the medication station. And don't forget to wipe the vial with alcohol. I'm sorry, I should have pointed that out. You have to wipe the vial for 10 seconds, let it dry for 2 or 3. And then I'm going to put a label on the syringe. I will put the date, the time, my initials, and what kind of medication is in there. I could also put the patient's name, okay? And then I'm ready to put the time that I drew it up, okay? And then I lock my kidney basin in the medication drawer, but I'll put that in my kidney basin. I'll put that in my kidney basin, and I'm ready to lock up and return to my patient. So now we've come back to our station. We unlock the cart, of course, and I could even open my bottom drawer just to remind myself where I'm at in my protocol. I have my locked syringe in the cart, okay, and now I'm going to prepare my IV apparatus. So I'll take the IV catheter. The Heplot. Several alcohol pads. Tegaderm, tourniquet, and a couple of 4x4s just in case. At this point, I can also take out my Versed always remembering to wipe off the stopper, let it dry, draw it up, and remembering to recap without touching. So I have my block drawn up, my IV material prepared, and I have my sedation ready to administer at this point in time. Next, I'm going to actually start the IV. That requires patient contact, Purell, gloves. I'll start the intravenous, wiping for 10 seconds. Let it dry. Got my IV in place. Even though the stopper appears to be clean, we're going to be extra super safe and wipe the stopper for 10 seconds and then let it dry before administering our Versed. I use a needleless system, but you still have to wipe it off with alcohol. I inject it. If you were using a needle system and you pulled off the cap, remember to cap with the recapper. Okay, so the Versed has been administered. We have our block ready. The nurse will be with us for the procedure. At this point, we would do a timeout. Once again, check the patient's name, date of birth, the anesthesia consent, the surgical consent, which side we're working, and what procedure we're doing. And then, with luck, we're going to have a very perfect block on the first time, and everyone will be happy. And the inspector will be really impressed. Okay.